All right, here we are. Thank you everyone for participating. Again, I'm Lisa Malachowski. I am the current president of the boy, that's bad. LGBTQ Democrats of Wake County. And we are here in these unprecedented times with this wonderful pandemic, not wonderful, this horrible pandemic, which we really do not know how it's going to end or what impact it's going to have overall on our world. But here we are in the middle of it. And as LGBTQ folks and our allies, one of the things that we thought would be interesting would be to have a meeting where we talked a little bit about the current status and included anything that was of particular interest to us that's going on at the municipalities in Wake County and the North Carolina House, as our representative will talk to. But the key thing to start with is I want to share a few things up front. One, we are co-sponsoring this event with Equality North Carolina, and they will not be speaking tonight, but they have helped us by uh, getting it organized and bringing participants to the table. So I want to thank Equality North Carolina for being a part of this. And the ground rules are basically that everyone who's a participant who's not speaking will stay muted. If you have a question, please put it in the chat box and put the word question in front of it so that we can bring it to the speakers. I'm assuming we will have a little bit of time at the end to entertain those questions, but if we don't and we run out of time because we are time bound at 8 o'clock, I will make sure those questions get answered later by the appropriate person they are intended for. There is another person other than me that is monitoring the chat so that if you have anything that you want to say, please put it in the chat and it will either get to me or it will be dealt with as it needs to be dealt with. Lastly, I will be the person that's muting and unmuting the speaker, so hopefully that will work and everything will go according to plan. So those are the ground rules and the beginning comments. I just want to make a few more comments about things that I think everyone probably knows are true for our community, but I will just want to highlight them because HRC, the Human Rights Campaign Foundation, came out with a position paper that really, I think, put everything in one place about why COVID-19 and our community why our community is highly impacted by COVID-19. Underlying all of our community's vulnerabilities are economic disparities, and those will be compounded with COVID-19. We are also more likely to live in poverty and lack access to adequate medical care, paid leave, and basic necessities. We're also predominantly working in highly impacted industries such as food service, hospitals, education at both the elementary, senior high school level, and college level, and retail. All of those industries have been highly impacted by COVID-19. And our seniors, LGBTQ seniors, they face double whammies. Sometimes they face discrimination that's not known until they get into an assisted living community. And they also sometimes face higher levels of isolation. So those are things to be considered. And then you have to think about our youth. Our youth are more likely to face homelessness. And with these times of schools being closed, food issues because they depended on schools for some of their food resources. Lastly, for our youth, sometimes they're being put in potentially difficult and unsupportive home environments due to family rejection or other issues at the family level. So these are all issues in our community that make matters worse. And of course, COVID-19 has been the coup de grace, combining with these things and making our situations a little worse than some of the other folks in the world. So I just wanted to share that with you. I thought it was a very good set of things that really highlighted for me why this is a challenge for us and why it's important to talk about it. And now let's start with our first speaker. Our first speaker is going to be Allison Dahle. Allison is our representative in the North Carolina House from District 11, and she's been in the House since 2019. She's on the House Select Committee for COVID-19 and is also in the working groups the working group that is focusing on continuity of state operations. So I am going to unmute Allison, and here we go.
Hey, everybody. I'm glad to be here. Thank you, Lisa, for that introduction. So I'm going to talk about the state level, what we did and what we passed. There was some education programs passed and some help for funding education, although we were not able to get the Wi-Fi, bus Wi-Fi passed or any money. There's a little bit of money there. There's some money for research funds, and I'm reading this because there was so much going on during this. Testing and tracing, public capacity. Unfortunately, there was no Medicaid expansion. The Senate wouldn't agree to that. We have money for food safety, shelter, and childcare. So if you are looking for childcare and you're an essential worker, you can go to Department of Human Health and Services, and they have a listing of people that would help you. I know that there are no essential workers anymore, but still, you can look that up. We, of course, have local government assistance. There's small business assistance. I am mainly focused on voting, and I'm not going to talk a lot about that, but what I'd really like to say is if you want to vote absentee, go ahead and send your absentee ballot in. Just do it, get it done, and that way you're on the list. There's going to be a large amount of people wanting to vote from home, and absentee ballot is the way. That is the only way that North Carolina has to vote by mail at this point. We are working on a second bill, and we're working to expand some voting. There's also going to be some more money for education, we hope, and probably more money for Department of Employment Security. If you are having problems with your employment security, your DES money, meaning unemployment money, please feel free to contact my office. I can either put you in touch with your rep or we can help you directly. I know that has been a real huge problem, and we've had some success, and we're going to keep on working on that. Lisa, I can be short and sweet. So I can take questions or we can wait till the end.
The one question I had that might be of interest, I think, is there is a session tomorrow that's focused on COVID, is there not?
That is the COVID, I think that's the health. Okay. That's not a session, that's a health. And you can go to ncledge.gov and look up, or .net, I can't remember which one because we have two different ones, and look up what COVID subcommittees are meeting, but I'm pretty sure it's health. Oh, economic support is what Ames said. And I'm not on that one, but that one's focused a lot on, DES and other things like that. So we have not scheduled the continuity of state meeting as of yet.
Okay. Well, if any questions come up, we'll focus them and come back to you at the end. All right?
Oh, sure.
Okay. Our next speaker is going to be Lindsey Lughes, who is the current executive director of the Raleigh LGBTQ Center. She was previously the LGBTQ Center director in Central Pennsylvania until she was hired here. And she's done lots of LGBTQ, boy, I'm getting tongue-tied tonight. You'd think I'd never said that acronym. Lots of LGBTQ nonprofit work. So I'm hoping Lindsey will give us an update on programs and the situation specifically as it relates to the center. And let me unmute Lindsey, and here we go.
Thank you, Lisa. So I am really excited to be here talking with all of you tonight about what we've been doing at the center. So the LGBT Center of Raleigh runs 30 programs regularly. And presently we've been able to transition, over the past couple of months, we've been able to transition nearly all of them to online programming and virtual programming, We've worked really closely with our partners at the LGBTQ Center of Durham and Equality NC to make sure that there are lots of virtual offerings happening right now, everything from book clubs to tarot card reading classes to some more serious things like STI workshops with Alliance of AIDS Services in partnership with them. So we've been able to transition so much of our programming online. And one of our big focuses right now has really been the isolation that so many people are feeling. We know that there are people who are sheltering in place with unsupportive family, and that's been a big focus of ours, making sure that those people have resources, connections, the ability to find an outlet, to be reminded that we still hear them, we are still here for them. That is particularly true for our youth and our seniors. So our Saige group has recently begun, in partnership also with Equality North Carolina and a few other organizations, to do a phone buddy system where they're having people give friendly phone calls on a daily basis to seniors, some who are living in assisted living facilities and nursing homes, which very understandably are under total lockdown right now, very nobody in, nobody out, which we understand the necessity of that, and also recognize the isolation that can cause and the loneliness that can come with that when people aren't able to visit their loved ones or have their loved ones there to visit them or do their normal activities. Our youth groups have been doing a variety of really cool things, like they've had Zoom sessions where they've watched films with members of our Saige group, and the Saige group has discussed these films with them and answered questions and given them some history around what it meant for them growing up as an LGBTQ person. And so some of these things that have happened have been really exciting and have definitely changed the way we're thinking about moving forward. Like, for instance, our Disability Alliance group has seen a huge uptick in participation, which is really making us think about how we continue to serve LGBTQ people living with disabilities. And, perhaps when we're able to all gather again, and we very much look forward to that day, we may bring in some Zoom offerings and have, virtual people join us virtually if it's easier for them to access that way, or think about hosting in different locations for accessibility reasons. So it's really strengthening our lens around and making us think through accessibility from a lot of different angles. One thing we've been very concerned about is, well, two things we've been very concerned about. One is HIV testing, which have been put on hold throughout the county for a period of time. Alliance of AIDS Services has resumed HIV testing, and while the center will remain closed, we are working with Alliance of AIDS Services to bring HIV testing back to the center. So we'll be able to open up a few nights a week by appointment likely for people to come in and still get HIV and STI tests. That's a really huge part of what we do. It's a big benefit to the community to be able to come into an LGBTQ affirming space and receive that testing. And then we've also been really concerned about the folks we're not reaching virtually. Under ordinary circumstances, the center is open 7 days a week for drop-in hours. And we have people who come in and use our cyber center and our library and visit with friends and get snacks. And, we definitely try to address needs of people who are food insecure. And we've been really concerned about how many people are not able to access this virtually, and we're not accessing them. So I really wanted to take a moment and let you know about St. John's MCC. They're a close community partner of ours, and they've done a ton of work right now to help meet the needs of those people we're not able to see virtually. We worked really closely in the very early days when we knew we were closing down to find out exactly what they were offering, how we could support this, and how we could get our folks who relied on us, again, sometimes 7 days a week, to know that they could go to St. John's MCC. St. John's is currently serving 600 hot meals a week, which I think is really impressive. We know they're one of the few spaces in Wake County still serving hot meals, so I think that's really exciting. They have 80 households using their food pantry, and they're doing a lot of great work. We know that pre-pandemic, they had asked folks, and a low estimate was about 50% of the folks they serve identify as LGBTQ. So I think it's safe to say that those numbers are probably the same now. And they're doing really exceptional work in helping to continue to connect people with resources, services, food, and necessities that they may need. So I hope that in the coming, as time goes on, we'll continue to work with them and partner with them and figure out ways that we can support people with more direct services. What the center historically does is we focus on social, educational, cultural offerings, and that can be done via Zoom, but it's, a lot of that real, the work for all the things you mentioned, Lisa, all the reasons why LGBTQ people are so disproportionately affected. And I love that somebody just asked in the questions about donation information for St. John's. St. John's on their website, so this is St. John's MCC. I can put the website in a second. They have on their website a list of needs that they have. So they're looking for food, as people feel safe and comfortable doing so. They're looking for volunteers, and they're, of course, obviously, monetary donations are always welcome for any of our organizations. So I would love it if people would support the direct service work they're doing there. So that's, if anybody has any other questions, feel free to let me know, but thank you so much.
One thing I wanted you to speak about a little bit, if you think it's appropriate, is mental health resources that might be available.
That's such a great question. So we've been working with NAMI, the local Wake County NAMI, to help train peer educators who can then provide some peer support in different groups. NAMI is doing a lot of that virtual work, and so we're just training some of their folks on LGBTQ identities and training some of our folks who are LGBTQ on how to provide peer support for mental health resources. Our website, the LGBTcenterofraleigh.com website, has a list of local therapists, and we're working on updating that to let people know what therapists are actively taking patients in a virtual format, who has availability, and just getting that up to date. So we have a team that's working on that. We are really working to expand mental health offerings in a more formal capacity. I will say that our youth group we have facilitators in our youth group who are mental health professionals. And so they've been able to really identify specific needs that the youth may have and connect them with resources. So that is, so much of this is pivoting all the time and figuring out how to address this. But as we're settling into some version of this new normal, I think we're really able to focus on how we can best provide these needs. So please follow our social media, of course, and our email list, and we'll be updating continuously with our mental health resources.
All right. Thank you very much, Lindsey. Our next speaker tonight is going to be Saige Martin. Saige is one of our 2 current openly LGBTQ Raleigh City Council members. Saige represents District D. He's also the youngest person ever elected to Raleigh City Council, and he's the first Latino elected to Raleigh City Council. Councilmember Martin is the vice chair of the council's Growth and Natural Resources Committee, and he's also on the council's Safe, Healthy, and Vibrant Community Committee. We understand that the last city council meeting on May 5th had a major update on COVID-19, so we're hoping you can speak a little bit to that and anything else that's relevant for our community. So welcome, Saige.
Sure. Thank you, Lisa, so much for putting this together. And thank you all to the presenters and those that are on. I'm going to keep my presentation more broad, just about to what Lisa mentioned, just kind of about the city's overall response to COVID-19 over the past couple of months, and I'll try to keep it brief. Councilmember Jonathan Melton is speaking after me, and I think he's going to speak more specifically to some of the initiatives that the council and city staff have stood up in response to COVID that specifically relate to the LGBT, have some specific overlap to the LGBTQ community. I think that, as Lindsey just said, pivoting is the name of the game for any organization, really any individual in this moment, and certainly local government is not different. We being the city council, owe all of the success that we've seen in the combat against COVID-19 to our city staff. At every turn, they have had our back, and they've been forward-thinking and innovative, and we've had to make really tough choices, but they've been the right choices to help ensure that the safety of our residents and the safety of city staff is put front and center. Some of the way that I've tended to describe this, Lisa, is that I've kind of seen both 2 things happen. There's been a contraction and an expansion during COVID-19 at the city level. And by contraction, I mean there are some things that the city has had to pull back on. And that's been frustrating and painful for some folks. And I think people need not think long and hard about what that looks like. Things like solid waste services, meaning yard waste, are some of the things that the city has had to halt for a short period of time, while we worked with our solid waste services team to put in place a better plan to better ensure our staff's safety and the safety of our residents. But during that time, it meant that there was lots of yard waste piling up in people's yards. Residents were upset about what that meant. When was this coming back online? And as a city official, as an elected official, Jonathan and I can both tell you there's nothing more frustrating for us or city staff to be able to not give a clear answer and to say it is going to be on this date and at this time. And that was what we had to do for a long period of time. And now we do have an answer. On the 19th at 6:30 a.m., trucks will start rolling, and we're going to start dealing with the backlog of yard waste that has piled up over the last number of weeks. Once that backlog is taken care of, we'll start back on regular yard waste service on the regular schedule that was on with your recycling. But that will take a number of weeks. So there have been a number of announcements about that. Along with the contraction also, obviously, you're looking at things like us having to limit our park services and access to our parks facilities and amenities. And that's a hard decision for us to make. We're known for our greenways and our parks amenities. And so having to turn people away and turn families away and young kids, especially when they're not in school, and parents are itching for a place to take their kids to spend time and to get that energy out, and they can't use that jungle gym, is a little bit frustrating for everybody. And so those were the harder decisions that we had to make, but we knew they were the right ones. At the same time, though, I can say that we expanded. And by that, I mean, very early on, our Raleigh water team and division worked diligently to expand access for large families who were spending more time at home, to make sure that if they started to bump up against the highest water rate usage tier, that they wouldn't start paying the highest rate of usage. That meant that those people with the largest families weren't going to be inadvertently burdened from a cost perspective by using more water, simply because more of their family members were home during the COVID-19 crisis. And that's important as we're looking across the equity spectrum, and we're trying to ensure that folks are having access to clean water during a public health crisis. We also we got rid of our paid public parking meters across downtown to ensure that anyone that did need to work downtown, anyone that had a doctor's appointment, was trying to quickly get food or groceries or run to the bank, had an appointment, could quickly and easily access those appointments without having to touch a machine, without having to interact with that piece of equipment, and also would not have the added cost and burden and stress of whether or not they would get a ticket if they forgot about updating their meter. And so these are some of the very quick things that the city has done. I'm missing a lot. What I do want to highlight, and Jonathan will speak to this as well, is just how innovative and forward-thinking the city staff was during all of this. There were so many times where I would think, oh my God, I have the best idea and I can't wait to tell so-and-so this. And then I tell them and they would very gently say, Saige, that's a really great idea. We actually thought of that a week ago and here's the plan. And then I realized that there's a reason that they have their PhD in that issue and that they're hired as city staff to do it. So I just want to say that we're in great hands, at the city level. And we're really blessed to be in the position that we're in. So I will happily, Lisa, let you introduce Jonathan to kind of talk more specifically about some of the policies that we've put in place that I'm really proud of as well, to have been able to support and work with my fellow council members on to help take care of the LGBTQ community here in Raleigh.
All right. Thank you, Saige. Appreciate your comments and your time here. Okay. Up next, we have Jonathan Melton, and Jonathan, obviously our other openly LGBTQ member of the Raleigh City Council. He sits in a at-large seat, at one of two on the City Council. And Councilmember Melton also serves as the chair of the Council's Economic Development and Innovation Committee, and is a member of the Council's Transportation and Transit Committee as well. So welcome, Jonathan, and we let you have the stage to speak.
Okay, thank you. Can you guys hear me okay?
Yes.
I've been on Zoom calls all day and I finally decided to invest in a microphone. So hopefully my next set of Zoom calls, my audio quality will be better. I think Saige touched on some of the big stuff that the city has done from maybe like 1,000-foot level, which has been, as he said, figuring out how to maintain certain city services while also having to scale back on others. There have been some specific policy initiatives and programs that we have stood up over the past couple of weeks as well that I'm going to highlight. So the first one is that we voted to provide $100,000 in emergency assistance to families and hourly workers living in hotels whose earnings have been adversely affected by COVID. And we did that by giving grants of $50,000 each to Passage Home and Triangle Family Services. It's not specifically earmarked, obviously, for LGBTQ individuals, but I do know that our community experiences a significantly high rate of homelessness. So hopefully, if any individuals who are at risk of being housing insecure or homeless, this fund will be able to assist them. Something else that we did recently is we allocated $1 million in funds for small business assistance. And I'm actually seeing the side chat here with Lindsey at the center. And I think that the center may actually qualify for some of these grants. So you may want to look into that, and we can connect offline to get you some more information. But we allocated the $500,000 equally to Wake Tech and to the Carolina Small Business Development Fund. So the Wake Tech program will support micro businesses, which are businesses that have 19 or fewer employees. And the Carolina Small Business Development Fund will support small businesses who have fewer than 49 employees. There were a few requirements to qualify. Specifically, you have to have lost 25% of your revenue. You can't make more than $2.5 million in revenue per year, and you have to have a storefront. There were some questions about why the storefront requirement exists, and I wish I had a better answer other than we only had so much money to go around. So when making policy determinations on where to allocate the funds, I think there was a choice between giving more people less money or fewer people more money. And one of the requirements was that you cannot pay yourself. So we tried to allocate the funds to businesses that would have more overhead expenses, such as rent or mortgage or utilities. And the money is intended to be a bridge to get them to the other side of COVID. And really a primary consideration was that we have so many folks right now who are unemployed because they've lost their jobs due to COVID. And a lot of these smaller brick and mortar type businesses employ a lot of our citizens. And so we need to make sure that they're able to reopen so that folks have jobs to return to when we're out of this situation. And then I think the last significant thing that we've done recently is we allocated about $2.8 million in Federal CARES Act money. We got $1.8 million from the Community Development Block Grant Program, and we got $1 million from the Emergency Solutions Grant Program. The Emergency Solutions Grant Program is going to be used to assist with homelessness and eviction prevention, including rent and utilities for households at or below 30% AMI. So AMI is the area median income. And just as a point of reference, 30% AMI for a family of 3 in Raleigh is about $25,000. So that $1 million is going to go to assist those families. And also that money is not dependent upon citizenship or immigration status. So a lot of folks who perhaps undocumented have not been able to receive other types of assistance would be able to receive this assistance. The other fund was the $1.8 million in the Community Development Block Grant. And that money we are allocating to mortgage assistance, rent, utilities for households that are above the 30% AMI, but not more than 50% AMI. So there's a window there. So those are the three, I think, substantial policy initiatives we've enacted. I also know that there has been a good sense of wanting to emerge from this COVID pandemic as a stronger and better community than we were before. And so I think what COVID has shown us is that there were areas for improvement in how we handle certain city services. I don't think solid waste services will return in the same way it had before. I think we found maybe looking at better ways to do it. We're also talking now about trying to free up some space on our roads so that bicyclists and pedestrians can have more access, especially as we're moving out of COVID, but still being mindful of social distancing. I know there's been discussion about allowing restaurants to have more space as well. And, you know, we've also had to learn how to do some remote meetings, which I think taught us a lot about the benefits of in-person meetings and also how we can do some remote meetings. And I think that's going to be helpful as this council continues to look at ways to increase civic engagement. It's a big priority for this council to reevaluate how we share and send and receive information and engage with constituents. And being thrown into the fire the past couple of weeks, I think, has taught us some good things, and we've learned a lot. So that is all I have. I'm happy to take questions as well. I'm sure I missed a bunch of stuff. Oh, I should have added as well that The Wake County and Raleigh stay-at-home order expired April 30th, so we are now following the state stay-at-home order, and we will be aligning our reopening of city services as closely as we can with the governor's phased opening approach for the state.
Okay, thank you very much, Jonathan. Okay, our next speaker is Audra Killingsworth. Audra is a town council member of Apex, and she was elected in 2017 for a term that runs from 2017 to 2021. Professionally, she is an occupational therapist manager, so she knows a little bit about healthcare, and my first interaction with her was actually where my mom used to live at a senior living village in Morrisville. Councilmember Killingsworth is also the chair of the Finance Committee, and many of you may or may not know this, but obviously she's on this call. She's a member of our community. So I want to welcome Audra, and I'm hoping Audra will also be able to speak to some of the actions that Apex specifically took regarding FMLA expansion and some other things that might be of interest to the folks on the call. So Audra, it is your stage.
Sure, thank you. So I want to talk a little bit, let's go timeline. Starting in March, we as a council stopped any disconnection from any electric or water non-payment. So we own our electrical grid in Apex, so we were able to make sure that people that were not able to pay were not disconnected. We needed to make sure they had access to clean water and utilities. So that was one of the first steps that we took. We expanded remote participation early on so that people could still participate in our meetings. The public could still attend the council meetings via remote access and participate in public hearings. And we've had that power officially given to us from the General Assembly in one of the recent bills that passed. So we appreciate that. So as part of our normal budget process, we fund nonprofits in the area. They go through an application process, and we had already done that as part of our early budget process, but we directed our staff to go back and talk with our nonprofits that we had funded previously to see if they had gaps that needed to be addressed because of the COVID-19 issues going on. And we were able to give more money and allocate more money for Safe Child, Transitions Life Care, Western Wake Crisis Ministries, and White Oak Foundation. All of those they're specialized nonprofits, but the general consensus was they needed nonprofits that needed extra support in feeding people and providing money for housing, utilities, providing support for people that were victims of violence and so on. We wanted to make sure they had extra support. We also, in May, passed $1 million in small business loans open to any small businesses within Apex. And that had some qualifiers on it, but as we started talking to the North Carolina Rural Center, which is administering the funds, they basically said if we want to help more people, we need to make sure that we put as little stopping points in there as we could. So that $1 million is in early May. I believe the application process started on either May 5th or May 6th. Something else that we've done as a council, and this is something we've been working toward over the past couple of years, spearheaded by Mayor Pro Tem Nicole Dozier in Apex, is expanding our FMLA policies and our paid family leave policies. We had at first expanded just to provide paid family leave, and then expanded it to include people that are basically a caregiver type leave. So if people were sick, then they could utilize the paid family leave to address that without losing their job. So we've been pretty busy the last few months, but we had signed on to the county order, and of course it was our mayor's prerogative to do those things. So we had signed on to the county order, and the last time he decided that he wanted to kind of skip the county order and just follow along with the state order. So we are currently, as Jonathan said earlier, we're all following the state order at this point with phase 1. So, and that's all I have for you. Wanted to try to keep it short and sweet.
Okay, thank you, Audra. Just give me a second here. Okay. Now we'd like to have Deb Hyson from the Raleigh Business and Professional Network speak. The Raleigh Business and Professional Network is the only LGBTQ Chamber of Commerce in the Triangle area, and it's affiliated with the National Gay and Lesbian Chamber of Commerce organization. Each month prior to COVID-19, the Raleigh Business and Professional Network held a business meeting that was associated with dinner, and also a social meeting. And that was a very interesting and intimate gathering for people within the community to get together and discuss issues that were important, whether it be at the social hour or the business hour. And those in-person meetings have been affected by COVID-19. So maybe the first question for Deb is, what's going on with the business community, and how are people within the business community figuring out ways to meet each other and talk to each other? So Deb, it is your stage.
Thank you, and thank you for putting this together, and for everybody who's been here today. The business community, whether it's LGBT or not, everybody's been affected. I think that goes without saying. But disproportionately, we know the LGBT community gets hit harder for a variety of different reasons. We have been, since 2008, meeting twice a month or 24 times a year. And we came to a halt in March, canceling our April dinner because the writing was on the wall for what was going on. And the first thing we want to do is make sure that all of our members are going to be safe. We have a large population who comes to our dinners who could be at risk for a variety of reasons, whether that's because they're a senior and they're retired, or they could have some kind of health issues, because you could have diabetes and this can affect you harder. So we took that and we stopped early on before it was mandatory. And that was just to be safe for our community. We were also in the planning stages with the LGBT Center of Raleigh and one of their programs, Saige, to put on Raleigh's very first LGBT Business Expo. And we also canceled that prematurely, but we're looking forward to rescheduling once we can call that something safe. In terms of the business community for the LGBT area, I've heard back from 2 sets of schools. There's places that have actually received the PPP loan. And for anybody who's not aware, that is the Paycheck Protection. And that loan basically covers 8 weeks of payroll, which could be 100% forgivable if you follow the guidelines that are provided. The unfortunate part is, whether you're LGBT or not, disproportionately, it wasn't really given to small businesses. We saw a lot of large corporations get that money, and an enormous amount of money. That the PPP loans, I believe, were up to $10 million. And we saw huge amounts of loans going out. So instead of a small business getting $10,000 or $20,000 that might really help them out, we saw companies who were getting $10 and $20 million, which really cut into the funds. And it was the money was easily gone in as soon as it came out. And you had the banks, which were in charge of the PPP loans, taking care of their large business clients first. When the PPP came back on the pike with a new funding, part of the SBA's guidelines to the banks was that it was truly supposed to be given out to small businesses, as well as the SBA set it up where they dedicated only handle the smaller business customers, which was a great thing. I've heard both from LGBT businesses within the Triangle who received the PPP loan, and it's been a tremendous help. And then I've also seen companies and people who have just not been able to have that happen yet. They're still either waiting in line or they haven't found out. The other major loan that was out there is the EIDL, which is the economic injury disaster loan. And that one was up to a maximum of $2 million. But basically the way that that one worked was you can get up to a $10,000 advance, which everybody thought would be great because you're going to get $10,000 to be able to work on your company. Shortly after it rolled out, they kept editing it and they realized with the amount of applications that they had coming in that they weren't really going to be able to give every business $10,000. So what it came out to be was going to be $1,000 for every employee you had, and you could consider yourself an employee. So if a small business had one employee, just themselves, or they had 10 or more people, they could get up to the $10,000, and they just had to go through the guidelines. The PPP program, you have to go to one of the SBA's lenders, which are regular banks and credit unions. They have a list on their website of all of those. And the EIDL loans, you would actually apply directly through the SBA directly. And then there's a couple of major differences within those as to what would be appropriate, as well as you could also apply for both loans and receive both loans. The max was one big difference. The EIDL loan had a max payout of $2 million, and the max payout for the PPP loan was $10 million. The terms were also slightly different. The EIDL loan could be paid back over a period of 30 years, which is actually fantastic for a lot of small business owners as they're trying to recover. And the PPP loan had a maximum pay period or return period to be paid back to the SBA of a 2-year period. The interest fees that were also very different. If you qualified for the PPP loan, after the part that could be 100% forgivable, which was at 8 weeks where you were using that to bring back your employees and cover payroll costs, those loans were going to be at just 1%, which was a phenomenal opportunity for business owners. And then the EIDL loans were going to be at 3.75%. And then with the deferral on those, with the PPP loan, you could defer up to 6 months. And with the EIDL, you could refer up to 1 year. On both of those, you could prepay either of them back to the SBA. And then the big difference was the PPP was meant to be used towards your payroll, your benefits, your mortgage, your rent, your insurance, your utilities. And the EIDL was supposed to really take care of other payable and benefits that you had for your company. And with the PPP loan, you did not need any collateral to be granted that loan. You just had to show your actual payroll. And with the EIDL loan, any loan over $25,000, you did have to provide some collateral. With the PPP loan, 75% could be absolutely forgivable, which is basically free money that the SBA was giving. And with the EIDL loan, that $10,000 could be forgivable, but again, it was $1,000 per employee you had. And the key thing is if you got it. So I know a lot of people who applied with the first round of both programs who haven't received it, and I'll say haven't received it yet. And part of that is their ticket or their number hasn't even come up for review. So there's people who are still in from the first round waiting for their application to come up. And I just ask people to be very patient. The SBA has done more in a month than in the month of 2020 between say March and April than they did all in the year of 2019 because they've just been overwhelmed. It was never designed for this type of an outreach, even though we've had major hurricanes and stuff. We've never actually shut down all businesses to the nature that we have. So they've just been tremendously overwhelmed. That said, you can actually get directly in touch with the SBA. They are taking phone calls. I've talked with 2 representatives directly, one to get in touch and just to get an update. And then we had one of the SBA's members, Patrick Rodriguez, as one of our speakers. So I had reached out to him early on just to give us a little bit of an update and to share some of the information so I could pass that on to the community. A lot of those updates as they were coming in, I posted to our Facebook page where a lot of people were following that information.
Okay, Deb, do you want to just say specifically what your Facebook page is, where all that gets posted?
Yeah, so we're under the Raleigh Business and Professional Network, which is the RB, like in boy, PN. And there you'll see, you can also put in Raleigh's LGBT Chamber of Commerce. Either of them should take you to our Facebook page. And a lot of that information as it's been coming through has been posted there.
Okay, and the question I had was, do you have any idea of numbers of businesses that applied for these types of loans that you're aware of in our community?
I don't have the numbers directly from the Triangle community. They were giving out just blanket numbers for how many people they had applying, and the last numbers I had were back in April, so they would not be current.
Okay. Okay. Well, thank you for that update. It's interesting to hear what's going on from a business perspective. I'm gonna bring Lindsey back on if we can for a second. Hey, Lindsey, there you are. There was a question that was asked about the grants or economic relief that the center has received and for how long will that aid last. I wanted to see if you wanted to share a little bit more information about that with the folks on the call.
Absolutely. So I also put in the chat box that if anyone knows a nonprofit that's struggling with the PPP process for the SBA, to reach out to me. I have definitely attended no fewer than a dozen webinars about it, and we applied for it and received it. So I feel like I'm not an expert, but I learned a lot in this process. So please connect them with me, and I put my email address in the chat box. So the center was one of the lucky ones, and it took a few tries and a few different we didn't receive the first round of funding. We were lucky to receive the second round of funding, and that has gone a long way towards helping us through until the end of June. One of the hardest things for us was Out Raleigh Pride brings in a third of the center's revenue. So the Out Raleigh Festival, which is a huge festival, 65,000 people attended last year. We've had to postpone that. We have, in March, we postponed it to August. I will say that we are staying in conversation with the city and looking at a lot of different things, looking to see what happens in this first phase of reopening before we make a further decision on whether or not this will happen in August. But I do think that having to reschedule it was one of the biggest blows. And we lost, in a matter of weeks, we lost, 6 figures in funding, which was pretty major and pretty scary for us. We have a great community that is really pulling together to support us, and we've received a number of donations. We're continuing to apply for grants. I was joking with my staff the other day that everybody's a grant writer now. They never thought they would write so many grants, but we are all kind of pitching in. We have a small staff. We have 4 full-time folks and 3 part-time folks, but everybody's pulling together and our community is supporting us. And I do trust that we're going to be okay. But I also am recognizing that all nonprofits are in a similar position right now. And we know that we're kind of in the, I don't want to sound doom and gloom, but we're in kind of the economic freefall portion of this, I feel like, in a lot of ways. I mean, people are being extremely generous, and also we're all feeling like, how do we plan, moving forward? I mean, what is going to happen? But one of the things that is amazing to me is people are still being generous. We ran a fundraiser for Giving Tuesday last week. All nonprofits were doing Giving Tuesday things, and I've spoken to a number of my colleagues, and they've all talked about how their supporters really showed up and supported them. So, I was saying privately to Ginger in the chat box, I was discussing how this has shown me, and I think a lot of us, how much we need each other, how much we need these collaborations, how much we need these partnerships, how valuable our partners are. That's why I'm so eager to reach out and connect with anybody who needs assistance through this. We often operate in these very narrow worlds and can kind of have some tunnel vision around what we all do, and just recognizing and remembering that we're all going to be okay as long as we're able to lean on each other, support each other, operate from a place of abundance and a place of knowing that LGBTQ people, marginalized people everywhere are going to, of course, bear the brunt of this, but we can continue to lean on each other and pull through. So, it will be interesting times for sure, but we are spending a lot of time working with really talented folks who are analyzing our budget with us and helping us be the best stewards we can be of the donations we receive.
It's good to know. And you said something I wish I could you said it really quickly. It was operating from a place of abundance of sharing information. I really love that. That's such an amazing sentiment. So if we can all get out of our swim lanes more when we're
Right.
back to quote unquote whatever the new normal is, maybe
Right.
we'll figure out what the new state of abundance looks like.
Absolutely.
So yeah, that was great. All right. Question come out of the audience that's for both Audra and Jonathan. Did your municipalities tap into the state's rainy day fund at all? So first I will ask that to Jonathan.
I don't know what the state rainy day fund is. I know that we have budget reserves for the city. I do not believe we've touched our budget reserves. We did have for this fiscal year, which runs through July, discretionary money, discretionary budget. The official term I'm blanking on right now, but that's where we funded some of the money for the homelessness grants. And then for the small business fund, we had money from the sale of some city property. But the city of Raleigh has a AAA bond rating. And to maintain a good credit rating, we have to maintain a certain amount of reserve money, which is within the city's scope of authority. And to my knowledge, that I recall voting on, we have not touched it. We did use some of what was left from this fiscal year in basically discretionary spending that hadn't been allocated yet.
Okay. All right, Allison, before I get to you, Audra, Allison wanted to add something. So let me let Allison speak first. Hang on.
So I was just gonna, the cities are not, they do not have access to the state rainy day fund. The legislature is the only entity that can spend that money. Unless somebody knows something secret that I don't, we have the power to, unfortunately, we have the power to either spend it or save it. And we did access some of that for DES, but I can't give you an actual figure. But the city, so we will disseminate money to the cities. Actually, I think it goes to the county. So that is money that is reserved for legislators to do with as they will.
Okay. I guess given that and lack of knowledge about what the process is, what did Apex come up with the strategy for how it was going to finance some of the activities that went on? Audra, hang on. Try now.
So we also have the AAA bond rating like Raleigh does. So we have to have so much in reserves as well. We had $8 million above our reserves. So that is where our small business loan came from, as well as our, well, just the small business loan. Our nonprofit was funded through normal processes.
Okay. All right, thank you. I believe we have a little bit of time here, and I'm going to try to allow Ames Simmons to come on. Let's see if I can get this to actually work. Ames, there you are. Let me try to unmute you. And I'd like Ames is, I don't remember your specific title for Equality North Carolina, but you can provide it. And Ames is going to tell us a little bit about what's going on with the rulings coming out of the Supreme Court potentially this week, as much as we know. And I don't have your pronouns in your name, so please give us your pronouns before you start.
Hey y'all, Ames Simmons. My pronouns are he and him, and I'm policy director at Equality North Carolina. Just like Lisa was saying, pretty much any day now, we are expecting to get a decision from the U.S. Supreme Court related to employment discrimination. So the legal framework of equality in our country was set forth in the Civil Rights Act of 1964, which prohibits discrimination based on race, color, religion, national origin, and sex. And Title VII of that act covers employment discrimination. So the case that's in front of the court is whether the prohibition against discriminating on the basis of sex also includes sexual orientation and gender identity. So they could rule on sexual orientation alone, gender identity alone, or the two of them together. So there are several different scenarios. based on the decision of the court, it could either take away rights that federal courts have been acknowledging for 2 decades, or it could affirm that existing law does provide us those protections. The next potential day that this might come out is on Thursday. So it's a little early in the court's term for them to be announcing decisions on Thursdays, but nothing is normal in their term right now. They're hearing oral arguments online. After that, also look on Mondays, because the court conference is on Fridays, so they get ready to announce the decisions that they came to on Mondays. This could be any time between now and the end of June. When a decision does come out, Equality North Carolina will have a community response, so stay tuned from us to hear more when that does come out.
All right, thank you, Ames. That's good information to hear. Does anyone have any other questions? Okay, we've got a couple minutes, so I'm going to try and close. I want to thank everyone for their participation. It's not easy when you do this for the first time, so I hope it went pretty well for all the speakers and everyone listening. Our organization and all of the Democratic organizations across the state are really at a point where we could use some help and volunteers on moving the ball forward and creating, wins up and down the ballot in November. So if there's anyone on the call who would really like to step up and help us with those efforts, I would ask you to reach out to me. You can do that either directly from the link that you signed up for this Zoom call with, or you can go to our website and find the information there to sign up for our newsletter and just put a comment in that you're interested in volunteering and helping us. If there's anybody on this call who really wants to be a treasurer, we desperately need a treasurer because it's something that I've been doing, and I'm not wanting to be treasurer and president at the same time. We do have a full board right now. Some of those folks are on this call, and I want to thank them as well for their participation. But the more the merrier, getting out the vote, which is very important, and making our needs be heard. We also need paid membership. So I want to tell folks that you can join our membership and support the work we're doing by going to our website and then clicking on the link that says become a member or donate. So that's there for you. Our state President Ginger Walker wanted me to remind everyone that the state organization, the LGBTQ Dems of North Carolina, is hosting a town hall on May 19th at 6:45, which will be focused on the election and voter protection. And Representative Dahle, who is on the call with us, and some other speakers will be on that Zoom town hall as well. And it'll be talking all about election 2020 and the efforts that are going on with voting protection and voting rights. So be on the lookout in your email for further information about that. It will be co-hosted as well with Equality North Carolina, who was our co-host tonight. So thank you again to Equality North Carolina. And as a final call for action, you can also donate to Equality North Carolina on their website, and that's equalitync.org/donate. So I want to thank everyone for their participation again, especially the speakers. I'd love some feedback if anybody wants to provide it, because we're probably going to do more of these going forward. So thank you all for your participation, and have a good evening. Take care. Be safe.